diseases, which claim 2 million lives each year, are likely to be the biggest emerging problem in 2025. Report: in 2025, public health concerns focus on the threats of bird flu, malaria, HIV, and tuberculosis. H5N1 influenza poses a potential pandemic risk due to its spread among birds and other animals. Malaria, HIV, and tuberculosis remain critical health threats, exacerbated by drug resistance, climate change, and inadequate healthcare access. As we prepare to welcome the new year with hearts full of hope and prayers for good health, there are certain aspects we must pay close attention to. One such aspect is the lingering impact of the pandemic, which is still fresh in our minds. Ever since we witnessed the grim impact of COVID pandemic, we have been asking ourselves, is there another pandemic threat on the horizon? With COVID in retreat, thanks to highly effective vaccines, the three infectious diseases causing public health officials the greatest concern are malaria, a parasite, HIV, a virus, and tuberculosis, a bacterium. Between them, they kill around 2 million people each year, a report published in The Conversation says, and adds, there are also priority pathogens, particularly those that have developed resistance to common treatments like antibiotics and antivirals. Scientists must remain vigilant, constantly monitoring for emerging threats. While any pathogen could pose a risk, certain groups, such as influenza viruses, are more likely to cause rapid outbreaks. However, a recent study showed that a single mutation in the flu genome could make H5N1 adept at spreading from human to human, which could jumpstart a pandemic. If this strain of bird flu makes that switch and can start transmitting between humans, governments must act quickly to control the spread. Centers for Disease Control around the world have drawn up pandemic preparedness plans for bird flu and other diseases that are on the horizon, the report says. Malaria remains a significant global health threat. The disease, caused by Plasmodium parasites transmitted through mosquito bites, continues to affect millions of people, primarily in sub-Saharan Africa. Despite significant advances in prevention and treatment, such as insecticide-treated nets and anti-malarial drugs, challenges remain. Drug resistance is on the rise. In addition, climate change is expanding the habitats of malaria-carrying mosquitoes, making more regions vulnerable to outbreaks. Economic instability, limited healthcare access, and disruptions from global crises like the COVID-19 pandemic have also hindered malaria control efforts, leading to increased cases and deaths. HIV remains a major global health concern. Despite advancements, the virus still affects millions worldwide. Stigma, inadequate healthcare access, and drug resistance hinder progress in managing HIV. New infections continue to rise in some regions due to limited prevention programs, lack of awareness, and unsafe practices. Tuberculosis, TB, can be a significant health threat, especially in low-income countries with limited access to healthcare. TB continues to cause millions of deaths annually. The rise of drug-resistant TB strains, such as multi-drug-resistant, MDR, and extensively drug-resistant, XDR, TB, complicates treatment and control efforts. Factors like poor healthcare infrastructure, malnutrition, and HIV co-infection further exacerbate the problem.